Hello and welcome to the North Coast Journal Preview, where we take a look at the stories being followed in this week's North Coast Journal. My name is Dave Frank, and I'm joined by North Coast Journal's news editor, Thad Greenson, and arts and features editor, Jennifer Fumiko Cahill. Welcome, guys.
Hello.
Dave, how you doing?
Good to see you again this week. I know we're all hanging in there in COVID land. So I'm going to kick off to you, Thad, and I bet you're going to give us an update about what's going on in Humboldt with COVID these days.
Yeah, so as every week and for the last couple months, most of the issue is focused on COVID, and the cover story is kind of focused on looking at this recent case spike we've had. As we're sitting here, we've had 31 new cases confirmed over the last 11 days, after a stretch with virtually no cases. I think there was 3 in the 17 days before that. So really, we're in the midst of a really significant spike, and it's coming right as the county is looking at, reopening businesses and coming up with plans to return some things to something somewhat, some semblance of normal. So the cover story this week looks at kind of the criteria the county has laid out for when it needs to pump the brakes, when it's going to realize, if it comes to a point where it realizes things are getting out of hand, it needs to scale back and reimpose some of the shelter-in-place restrictions that have been lifted on stores and businesses and stuff. But what I wanted to kind of talk about today is one sliver of this case spike that we've seen, that is really is centered at Alder Bay assisted living. And as we've seen across the nation, when COVID gains a foothold in an assisted living situation or a skilled nursing situation, it can be really devastating, and it's really hard to contain it and to keep it from spreading through the facility once it gets there. So in Alder Bay, I'm sure most people know at this point, we've had our first 2 fatalities in Humboldt County of COVID, both Alder Bay residents. Total of 7 residents so far have tested positive there, as well as 5 staff members. They're really aggressively trying to monitor the situation. They're testing every couple days. They've got really strict protocols in place. But like I said, just once a virus gets into a facility like that, a congregate living facility where all of the residents are vulnerable in one way or another because of age or underlying medical conditions, it can just be really devastating. And so actually, Jen and I wrote an editorial this week about kind of addressing that aspect and how do we protect these vulnerable populations. And there's been talking points that we've all seen on social media. We've heard them, in conversation probably with people that we know, and certainly some of them were raised at the Board of Supervisors meeting on Tuesday. But this sentiment of, because COVID has these really disproportionate impacts on vulnerable populations, on seniors and the infirm, why don't we just wall those people off, keep them at home, and the rest of us can just resume our lives? And that should be fine, right? That should be sufficient to protect these people. So our editorial really focuses, first, that this disease can be truly devastating on young, healthy people as well. But even if the goal is just protecting the vulnerable, the way to do that is really limiting spread entirely. And I think the situation at Alder Bay is a perfect example. They had all the internal protocols in place there to keep residents safe. And a staff member happened to, get the virus through community transmission, through just, living his life and going shopping, or his or her life, I'm not sure. And then was asymptomatic and brought it into the facility, and it spread from there. And so some people have said, well, why don't these facilities test all their staff members all the time? And there's just huge limitations on testing, as we've reported over and over again, and especially on the tests that are like instant read tests where you get results within an hour. And so there just isn't the availability of tests to test every staff member at the beginning of every shift. And so really, there's no way to prevent an asymptomatic staffer from carrying the virus into the facilities. And so the best way to protect these facilities is to protect the entire community and limit spread as much as possible. Because, like the rest of us, a skilled nursing staffer has, their family unit. Maybe a member of their family unit is an essential worker in another function. Maybe they work at the supermarket. And so maybe, you not refusing to wear a mask and refusing to practice social distancing, brings COVID into a skilled nursing facility staffer's home, and then they bring it into the nursing facility and it spreads from there.
So
So
thanks for spelling that out for us. I'll have to read your editorial just to get more details.
mhm.
But did you mentioned that this was talked about in the supervisors meeting? Was it
Mhm.
brought to this level of clarity to people on a public forum the way you just described it?
No, it wasn't I don't think it was explained it wasn't explained in this way. What I was referring to is one of the supervisors basically made the comment of, why don't we just protect, keep the frail and the elderly at home, and the rest of us can start opening things up because it disproportionately protects
And
those
that
folks.
supervisor is how old?
He is a senior.
Oh.
He also mentioned, he was talking about the Supervisor Expo, and he was talking about the antsiness of some people to open up and restaurants to open up. And he made a passing reference to that he'd heard that some people from Humboldt County had traveled to Reading in Shasta County, which has opened up some of its restaurants just to dine out. So they just drove out, dined out, and came back here.
Two things that we're not meant to do is to leave the area, travel outside the county, and come back, and also to dine out with other people who are not wearing masks.
Congregate with people outside of our households. It's a bad idea. So
It's important to know too, and it's easy to see all these headlines that this casino is planning to open, that casino is planning to open. It can make you think, well, if they're doing that, it must be okay. But remember that those are businesses making a choice, not health officials making a choice.
Well, and our public health officer has been very outspoken about both how bad an idea it is for casinos to open right now, how there's no way not to construe a casino's operation as a mass gathering, and with the potential to not just expose a handful of people, but expose hundreds of people at one time, which is super dangerous on all kinds of levels, and including just the risk of just totally overrunning our healthcare capacity. But as you were saying, Shannon, she's also been very outspoken about, the dangers of congregating with people outside of our household. It's just kind of furthering community spread at this point. So.
I mean, I know I've been asked by a few people about the governor's plan, and so this is the expanded phase 2 or the advanced phase 2 that I think some of the counties have implemented. And you mentioned that last week we received, our county submitted a request and received approval, but there were some contingent metrics basically that we needed to follow. Can you just tell us if the most recent few days, the new cases, does that sort of violate the standard that we were supposed to meet when we did get approval?
Well, if we were applying for approval today, we would not meet the standards. But once we get the approval, then we have a kind of a different set of metrics that we need to use to determine whether we need to scale back some of the loosening of restrictions that we've done and stuff. And so, that's where we are now, and that's kind of what the cover story this week goes into. And they basically are under 3 criteria. There's epidemiology, so just how the virus is spreading locally. There's healthcare capacity, and then there's public health capacity. And so at this point, we're kind of getting into dangerous territory as far as epidemiology and the spread of the virus, because it is really ramping up and spreading more quickly. But health officials feel like we have sufficient healthcare capacity still and sufficient public health capacity to trace and isolate cases and stuff like that. So we're not scaling back right now. That said, Dr. Frankovich has said that she plans to slow the rate at which she's approving businesses to reopen in modified ways. So.
And we can still screw this up.
Certainly.
Yeah, to be determined, right? We'll just have to keep monitoring it. So thank you for bringing us up to date on this, and we'll go check out North Coast Journal online for more. How about you, Jennifer? What's going on the Arts and Features beat this week?
It is all seniors all the time. We are actually looking in the food column on the table at a local businesswoman. She owns 3 restaurants locally. Christine Silver owns Humboldt Soup Company. She owns 6th and E, where the fried chicken is very good. It's a burger place, but you should have the fried chicken. She also has, what's the other one? Delish on 5th, the fancy deli and kitchen store. So all 3 of those, juggling that is a lot. Juggling that under a pandemic is a lot. And margins for restaurants are always tight. They are tighter for restaurants now. If you think it was hard to keep, a big sit-down restaurant going in normal times. Now, with everything takeout and, the cost of everything going up, it's even harder. And so in the middle of all this crazy, and in the middle of the rush of trying to maintain her businesses, figure out how they can open safely, how she can keep her employees working, she decided, I need to start giving away food.
Oh, wow.
So, she was an early adopter. She was reading up on the virus way before lockdown, and she was getting, sanitizer and every masks and stuff for her crew. And in her sort of, preparedness mindset, she looked around and she was reading a lot about vulnerable seniors in group facilities. And right up the road from Humboldt Soup Company is the Salvation Army's low-income senior housing unit, and it's called Silvercrest Residence. And she had this panic in her mind, thinking like, they're just eating like industrial cafeteria food. She's like, I need to get them some wholesome food. And so she figured out, after a couple of tries, she got in touch with a woman named Loretta Scott, who is the lieutenant over at the Salvation Army, and figured out a way to bring over a big pot of soup,
Oh, wow.
2 to 3 times a week. And she makes these, healthy chicken soups and things to bring over to feed people. And
Like
in doing
150 people, right? I mean, they have a
yes,
lot of
it's
residents.
154 people. It's such a big pot. You could get in this pot. So anyway, she does this, and she was planning on doing it for a few weeks, and then 3 months later, she's still doing it, and it's expensive and it's difficult. And eventually, they figured out a way for the Salvation Army to pay for her ingredients, but she's still doing all the labor, and the labor involves between 5 and 7 hours of cooking when you are still trying to run 3 restaurants and trying to make all this soup for your drive-through soup place. But it was really something. She was really driven by this kind of magical thinking. She actually said at one point, in my mind, I thought, if I can just make them healthy food, they won't die. And
Oh, wow.
I think a lot of us have these moments where we think, if I can just do this thing, if I make sure to, be very, very good about, either a habit or, a goal, we've set some quest for ourselves that makes us able to kind of hang on in difficult times and in uncertainty. And she really went all in. And it turned out to have an additional benefit, along with, feeding people, allowing her to sleep at night. It also gave the seniors some contact with people, because they're in lockdown too. And, if you are poor and you are elderly and you are isolated, I mean, that's a very tough way to spend months and months of shelter in place. And
Definitely.
the knock on the door from a masked staff person with lunch, or with dinner, with a bowl of soup, and, hey, how are you doing? It turned out to be a really important check-in for people. And at one point, when they thought they would have to stop because the financial toll was just getting a bit heavy, Loretta Scott said, can we find a way to pay for this, to make it possible, because these people are really looking forward to these visits and really looking forward to the soup, and getting the sense that someone cares about them, that they are not, disposable people. And Christine Silver has yet to meet any of these people. She can't go in to the facility.
Oh, wow.
But it's at a time when people are legit on Twitter saying that old people are expendable, I feel like these gestures are important.
Oh, definitely. Yeah, this is really great to hear. I mean, so I'm glad we're getting to know. First of all, I'm glad someone's doing it, but
Yeah,
it's
it's
even
great.
better to hear it, because I think we need a feel-good story.
Yes. And it's good soup. I have had the soup.
I love their food there. Actually, it's really good. I haven't been since before the the lockdown, but the shelter in place. But definitely, I like Humboldt Soup Company. So that's really cool that she did that. Is there anything else you want to add before we wrap up today?
Thad?
Either
I mean,
you
we
guys?
have
I was just going to chime in to say that it's a really wonderful story, the soup story, and it's really inspiring too, and really shows that that one person really can make an impact on a lot of people by by following those impulses.
And that's all the good news we're going to give you for the rest of the year.
At least for the
So
week.
enjoy it. Yeah.
Well, thank you guys very much. That'll just about do it for this week. North Coast Journal is on newsstands now, and also you can find them online. Pick one up. Stay informed. Thad, Jennifer, thank you so much. We'll see you guys again next week.
Yeah, always
See you
fun,
next
David.
week.